But scientists are right now monitoring a new version of the highly contagious Omicron variant. 5 News reporter Tiffany Lee joins us live to tell us where it's been detected so far and how health officials here in Arkansas are preparing for its potential arrival here. Tiffany?
Hey, good morning. So yeah, ever since Omicron came to Arkansas, we've seen it spread like crazy. In fact, a lot of us probably even know someone who's had it if we haven't had it ourselves. And now a new subvariant of that strain has been detected. And it's not here in Arkansas just yet, but it is close to home. Earlier this month, a subvariant of the Omicron variant was found in the state of Washington. Now, it's natural for viruses to mutate, but doctors are looking at research saying that the new subvariant could respond to vaccines a little differently. They could be less effective, or they could even be more or less infectious. Now, we did see some different subvariants of Delta as well, but not as many differences. Now, this new subvariant hasn't hit here at home just yet, but it's right next door. Some traces of that new Omicron variant were found in wastewater samples in Missouri. Researchers haven't said exactly what those traces are and where they were found, but they say that more research is needed to figure out just how serious this new subvariant could be. Governor Hutchinson says as a state, we will continue to roll with the punches, but he encourages everyone to keep doing their part to stay safe, and he hopes that the rest of the country will do the same.
The whole country is ready to manage this disease, this virus, versus the current state of emergency. And hopefully with the vaccinations that we have, that we'll be able to manage this as other health needs that we have in our society.
Again, there are still many unanswered questions about this new subvariant, but as we learn those details, we'll keep you updated on the latest. For now, I'm in Fayetteville, covering news where you live. Tiffany Lee, 5 News.
All right, thanks a lot, Tiffany, for that information. Now, Arkansas is actually seeing a decline in our 7-day case rate in nearly every age group except the 65 and up age group. But the impacts of COVID are still here, as you might imagine. Governor Hutchinson announcing the pandemic has had a big effect on our workforce, especially in education and in healthcare. They're not only experiencing burnout, but they're leaving their jobs as well. Governor also saying that the state is working on ways to recruit more people into these fields. Meanwhile, the state Secretary of Health warning that even with the case rate declining, he does expect hospitalizations and deaths to continue to trend upward.
That we're going to see a daily number that's going to persist. And that daily number will affect the number of hospitalizations we have, as well as the number of deaths. As you've seen, our deaths are not going down. They've plateaued, really. So I think that's what we're going to see into the near future.
Now, the state, by the way, did report another 24 COVID-related deaths in the last 24 hours.
Let's go ahead and break down the latest COVID numbers for you. As Ruben just mentioned, the death toll, but another 7,943 people have tested positive in the past 24 hours. But if you look here, our active cases have dropped for a third straight day, now under that 90,000 mark this morning. So less than 90,000 Arkansans are known to have the virus in our state right now. But sadly, another 24 people have died from COVID-related complications, bringing our total number of deaths since the start of the pandemic up to 9,556. 1,785 people are in the hospital this morning, which is down from our record that we set earlier this week. You will notice 233 of those patients are relying on a ventilator this morning.